Welcome back, guys. I hope you are all doing well. So, today's my topic of discussion is about the third pathway of the basal ganglia, which is nigrostriatal pathway. The function of this pathway is the modulation of the direct pathway and the indirect pathway of the basal ganglia. So, okay, first pathway is direct, second is indirect, and third is nigrostriatal pathway, whose function is modulate the activity of direct and indirect pathway. So first I draw the structure and explain you how the nigrostriatal pathway modulate the activity of the direct and indirect pathway of the basal ganglia. So first I draw the direct pathway. Guys, if you want to see the complete video of direct pathway, you must see the previous two videos in which I discuss the direct and indirect pathway in detail. This is caudate nucleus. This is putamen. This is globus pallidus, have two parts, internus and externus. Here is thalamus, and here is a two nuclei of the thalamus, ventrolateral nucleus and ventroanterior nucleus, okay, who involve in the direct and indirect pathway. So first I draw the pathway. The rose goes from cortex to the caudate nucleus, also goes to the putamen. From here the neurons goes to the, in the direct pathway, globus pallidus internus here. From here the axons goes to the thalamus, ventrolateral and ventromedial nucleus, and from here again it back to the cortex. Okay, start from the cortex and end from the cortex. What are these cortex? Motor cortex, okay, primary motor cortex anterior to the central sulcus. Okay, so this is the pathway of the direct pathway, okay, of basal ganglia. So here I draw one more structure which involve in nigrostriatal pathway. Who modulate the activity of direct and indirect pathway. This is a structure, okay. What are the name of this structure? This is substantia nigra, okay. What are the name of this structure? This is substantia nigra. This involve in this pathway. How it involves? I have to draw. It act on the caudate nucleus, also on the putamen. It means it act on the striatum, okay. Caudate nucleus and putamen, if I combine it, it is called striatum. So it act on the caudate nucleus and striatum and modulate the activity. Now I show you the action potential. Okay, from the cortex the signal move to the caudate nucleus, and putamen is excitatory signal, so I write positive, and it stimulate it, okay. Also from the caudate nucleus and putamen, now the action potential goes to the globus pallidus internus, okay, which is what are the neurotransmitter? Glutamate send these signals, okay. So increase the action potential, and glutamate also stimulate it, okay, globus pallidus internus. Now here globus pallidus internus, here what are the neurotransmitter? Is GABA. What are the neurotransmitter? GABA, okay. Now GABA is inhibitory neurotransmitter. So here the GABA is released, a lot of GABA is released. It means the action potential of a lot of action potential of GABA is travel to this axon towards the thalamus. It means if there is a lot of GABA, there is a lot of inhibition. Okay, okay. When there is a lot of inhibitory signals, when there is a lot of inhibitory signals, there is a more stimulation of the excitatory stimulus. So there is a lot of excitation goes to this axon. Okay, when this is too much excite, okay, then what are the activity? The increase motor activity. Okay, increase motor activity. This is the normal pathway, direct pathway. Now I tell you how the substantia nigra, nigrostriatal pathway involved in direct pathway. So here is also a activation of, here the signal comes towards the caudate nucleus and putamen, which release dopamine. Dopamine is act on the caudate nucleus and the putamen on that receptor which is inhibitory or stimulatory. Okay, in this case in direct pathway the receptor is D1 receptor. What is this receptor? D1 receptor. D1 receptor of dopamine. So when the substantia nigra send the signal to the caudate nucleus and the putamen, it release dopamine, and dopamine act on D1 receptor of the caudate nucleus and putamen and stimulate it. It means here is a lot of stimulation also from the glutamine, okay, and also from the dopamine. Okay, glutamate and dopamine both are stimulated the caudate nucleus and putamen. So it means a lot of stimulation, a lot of signal goes to the globus pallidus internus. Okay, so here a lot of stimulation. Okay, so when there is a lot of stimulation, there is a lot of GABA release, and a lot of GABA travel towards the thalamus, and when it acts on the thalamus ventrolateral ventro-anterior nucleus, it inhibits a lot of the signals, and when they inhibit a lot of the inhibitor signal, it means the action are stimulated. Okay, GABA receptor inhibit the signal, okay, and the local reaction are stimulated. So a lot of action potential is gone up towards the cortex. So what happens? It more increase the motor activity. Okay, more and more increase the motor activity. Okay, so this is the pathway, direct pathway, in which nigrostriatal modulation occur. Okay, so what are the importance of this pathway when there is damage? Okay, guys, clinical importance. Clinical, there is a damage of any direct pathway structure or substantia nigra are damaged. Okay, what are the disease process? There is a Parkinson's disease, okay, in which the patients are unable to initiate the movement. Okay, like this type of problem which is due to the damage of direct pathway or nigrostriatal pathway, okay, which involves in direct pathway of the basal ganglia. Okay, now this is the direct pathway. Now I tell you the indirect pathway. How in indirect pathway the striatum works, okay, and how the action potential travels to the axons and the structures related to it. Now I again draw the structure. Now this is the cortex. Okay guys, this is the cortex. What are the name of cortex? Motor cortex, anterior motor cortex, primary motor cortex, motor association cortex of the brain. Now here is caudate nucleus. Here is putamen. Here is globus pallidus, internus and externus, have two parts. Here is, what are the structure? Thalamus. It also involved ventrolateral and ventromedial nucleus in the indirect pathway. So in the indirect pathway, one more structure involved. what is this structure? Subthalamus. This is subthalamus. Okay, and now I first draw the complete structure pathway. So what happens in this pathway? The action potential from the cortex goes towards the caudate nucleus, also the putamen. Okay, from here the action potential goes towards the globus pallidus externus. From the globus pallidus externus it sends the signal to the subthalamus. From the subthalamus it again sends the signal to the globus pallidus internus. From the globus pallidus internus it sends the signal to the thalamus, ventrolateral and ventro-anterior nucleus. From here again it sends to the signal to the cortex. Okay, this is the pathway. This is the indirect pathway. In previous videos I explained complete pathway related to it. Okay, and related to diseases. So now today's I tell you the one more structure, which is substantia nigra. What is this structure? This is substantia nigra. How it involves in this pathway, in indirect pathway, and modulate the activity. So I have to draw it. It act on the putamen, also act on the caudate nucleus and release dopamine. Okay, the same manner as in direct pathway, but one difference is direct and indirect pathway. Nigrostriatal pathways dopamine act on in the direct pathway D1 receptor. Okay, in the indirect pathway it act on the D2 receptor. Okay, which is inhibitory receptor. D1 is stimulatory. That's why there is a lot of stimulation from the caudate and putamen towards the globus pallidus externus in the direct pathway. Now in this pathway the dopamine act on D2 receptor, which is inhibitory receptor. Okay, so the same action potential. Okay, from the cortex the action potential goes towards the caudate nucleus is glutamate, which is excitatory neurotransmitter. Okay, both are excite. Okay, so also from the substantia nigra there is a dopamine is released, which is act on D2 receptor. Okay, now in this case D2 receptor. In direct pathway D1 receptor, in indirect pathway D2 receptor. The difference is this. Okay, so D2 receptor, which is inhibitory. It means there is a stimulation of the caudate nucleus and putamen from the cortex, and there is a inhibition from the substantia nigra also. So it means there is not a lot of action potential generated. So there is a less action potential goes to this area, globus pallidus externus. Okay, less action potential goes to here. Okay, here is what neurotransmitter is GABA. If there is a less stimulation, there is a less secretion of the GABA. So from here to here, subthalamic nucleus, there is a less GABA. Okay, okay guys, from the caudate nucleus and the putamen the action potential goes to the globus pallidus externus is decrease. Okay, if there is a action potential decrease, there is a local stimulation of it. Okay, and there is a GABA is released. So the activity of the GABA from the globus pallidus externus and the subthalamic nucleus is gonna increase. Okay, what it gonna increase. So when GABA is released here, so what happens over here? The GABA is released, but not too much. Okay, so it means their action here is also a release of GABA. Okay, so there is a less GABA, there is a less stimulation of these axons. Okay, and it enters in the globus pallidus internus. Okay, so here what are the neurotransmitter release? So there is a inhibition, less inhibition. Okay, so what are the neurotransmitters is glutamate. Okay, is here glutamate. So when there is a glutamate is released, so the action potential to this axon is travel towards the ventrolateral and ventromedial nucleus, okay, which is not too much, because there is a less glutamate is released, so less action potential. When there is a less potential generate over here, what happen, the activation of these ventrolateral and ventromedial nucleus occur, so there is a action potential which travels towards the cortex is increased. And what happens over here, the increase the activity of the indirect pathway, okay, indirect pathway is increased, okay, in the case of modulation of the activity, okay, with the help of what are the structure substantia nigra, okay. So in the direct pathway, in the indirect pathway, the activity of the pathways are modulated and increased, okay. So guys, this is all about the two pathways, direct pathway and indirect pathway, and now today's lecture is nigrostriatal pathway, which involves in direct and indirect pathway. I explain in detail. Please guys, made the notes, please like, share and subscribe and press the bell icon, okay, and subscribe must and made the notes, okay guys. Okay guys, I hope you understand my video. So guys, goodbye, be happy. Okay guys, one more concept is clear here. When there is a glutamate, a globus pallidus internus sends the signal to the thalamus, okay, it sends the signals which is decrease in action potential, okay, at the end of the thalamus. So at the thalamus, what are the neurotransmitter release is GABA, okay. So GABA is released over here in the thalamus, okay. So when there is a less glutamate stimulate the thalamus, ventrolateral and ventroanterior nucleus, there is a less GABA secretion. When there is less GABA secretion, it means there is a GABA is a neurotransmitter which is inhibited neurotransmitter. If there is less GABA, it means less inhibition, okay, and more stimulation, opposite to that, more stimulation. So there is a lot of action potential goes towards the cortex, okay guys. Not confuse in the pathways, okay, please must watch and make the notes, okay, and clear the concepts related to pathways. So guys, I hope you understand my video. Please like, share and subscribe, and goodbye, take care.